Welcome to this video to talk about the cholelithiasis or the gallbladder stone. Many patients at the emergency room or at the clinic is what we call the gallbladder stone or the cholelithiasis. Okay, so actually one of the important things to know is that gallstones are more common to happen with old age people. Okay, so you can find about 25% of US females have gallstone at their 60s, and about 12% of the US males will have gallstones at their 60. And actually you can find even more than these numbers in other countries like Sweden, for example, for Chile, for example. About 50% of the population will have gallstone at the age of 60. Okay, other ethnic groups like Indian, Pima, and so on will have also huge numbers. Okay, so the point here is that gallstone is an important and common issue in surgical patients. The gallstone increase with age increasing. Okay, when we talk about gallstones, we actually talk about three important categories of gallstone patient. The first one is the asymptomatic patients, and the second one is the symptomatic patients, and the third one is the complicated gallstones. Okay, so a lot of patients with gallbladder stone will have no symptoms, and this is the first category of gallbladder stone patients, and other patients will come with right upper quadrant pain and other symptoms, and this is the second category. And sometimes the symptomatic patients will, or the asymptomatic patients in rare cases, will be complicated. Some fistulas and other complications will be there, or cholecystitis and infection of the gallbladder. All these things can happen with the gallbladder stone. Some good thing to know here is that the gallbladder three categories are can happen in a stepwise. Okay, so the asymptomatic patient may progress to symptomatic patients in about 1 to 2% annually. Okay, so about 1 to 2% asymptomatic patient will become symptomatic every year. Okay, less than 0.5% of asymptomatic patient will become complicated. Okay, but the symptomatic patients are more prone to be complicated gallbladder stone. With Western lifestyle. Okay, so obese females with Western lifestyle are more prone to have cholesterol gallbladder stone. Okay, cholesterol gallbladder stone. Actually, something important about the gallbladder stone, the cholesterol one, is that they are what we call radiolucent gallbladder stone. What do we mean by radiolucent? It means that it's hard to be visible on the X-ray. It's invisible on X-ray because the beams of X-ray can easily just penetrate the cholesterol gallstones. So most of the times you can't see the gallbladder stone on the X-ray, but the pigmented gallbladder stone are more to be seen with the X-ray because they are radio opaque stone. Okay, so cholesterol gallstones are more with obese, with Western food style diet, and with females. And part of the cause that females are more prone to have cholesterol gallstone is because of pregnancy and because of the use of oral contraceptive pills. Okay, pigmented gallbladder stone actually are divided into many types. The most important two are the brown and the black a plaque gallbladder stone. Okay, the plaque gallbladder stone is mostly due to accumulation of bilirubin malabsorption. So you can find like calcium bilirubinate, okay, calcium bilirubinate, and calcium phosphate, calcium carbonate. Okay, all these contents are common in a plaque gallbladder stone. The plaque gallbladder stone is hard and spiculated and brittle. Okay, so the risk factors of the plaque gallbladder stone are mostly like hemolytic disorders, cirrhosis, and ileal resection. And if you notice, all these things will lead to accumulation of bile acid, okay, and bile the bile. Okay, so this is the plaque pigmented gallbladder stone. What about the brown gallbladder stone? The brown gallbladder stone is soft. The black is hard. The brown is soft and associated with biliary stasis and infection, like Klebsiella species infection. Okay, it of bacterial cell bodies, calcium bilirubinate and calcium palmitate. Okay, so calcium bilirubinate are more with the black stones, but the brown gallstones are also prone to have calcium bilirubinate content. So the first category of gallstone is the asymptomatic gallbladder stone. Okay, and these types of stones are found incidentally, like in an incidental ultrasound for other reason. Okay, so here we can see the gallbladder stone and the acoustic shadow of this gallbladder stone, and we can find it also in some laparotomy for other causes. So how to manage an asymptomatic gallbladder stone? Actually, the management of asymptomatic gallbladder stone is rarely to be surgical. It's not the asymptomatic gallbladder stone is not an indication for a cholecystectomy. Okay, but in some cases we have to do cholecystectomy, like in porcelain gallbladder, which is a calcification of the wall of the gallbladder, extensive calcification, as we can see here. This is an indication for cholecystectomy even in asymptomatic gallbladder stone because of the risk of malignancy associated with the porcelain gallbladder. The other indication is the gallbladder stone in children. Okay, children is a relative indication for cholecystectomy in children with gallbladder stone. Prophylactic cholecystectomy actually is controversial in adult patients with sickle cell anemia and with the incidental finding of gallbladder stone during the surgery, because the literature did not magnify or explain whether the symptoms of gallbladder stone will happen in high rates after surgery, so that it's better to do cholecystectomy during incidental finding of gallbladder stone during surgery. Now let's move to the other group of gallbladder stone, which is symptomatic gallbladder stone. Actually, there are many differential diagnoses for symptomatic gallbladder stone, or many differential diagnoses for right upper quadrant pain, just like renal colic, peptic ulcer disease, and liver disease, GERD, or inferior wall myocardial infarction. Actually, the diagnosis of gallbladder stone cholelithiasis is established by the typical pain of gallbladder stone with imaging that shows a gallstone, ultrasound that shows a gallbladder stone. Okay, now what about the typical description of pain in the gallbladder stone? The site of pain is in the epigastrium or in the right upper quadrant. And about the timing, the pain happens just an hour after eating a fatty meal, okay, and it may awakes the patient from the sleep. And actually, when the pain comes, it lasts about 30 minutes to several hours. Okay, actually, the pain of gallbladder stone is intense. Okay, it's an intense pain and may cause the patient to restrict breathing. Some other symptoms that may be associated with the gallbladder stone pain, which is hypochondrium, right hypochondrium, or epigastric, is radiation of the pain to the right shoulder or to the back of the patient, sometimes to the left upper quadrant. Also, nausea and vomiting can happen in addition to this pain. What about the physical examination of the gallbladder stone? Actually, most of the times you will find mild right upper quadrant pain. Okay, Murphy's sign may be positive. Okay, jaundice will not happen for gallbladder stone per se. Okay, if there is no inflammation and you find that there is a jaundice, so this is questionable. Okay, now how to diagnose a gallbladder stone? The best method is the ultrasound. Okay, ultrasonography will show us an acoustic, okay, echogenic gallstone, okay, as we see here, with something we call the acoustic shadow. This is a shadow, posterior shadow of the gallstone on the ultrasound. So this is echogenic stone and acoustic shadow. We will rarely have thickening of the gallbladder wall if we have gallbladder stone just without cholecystitis. Okay, so it's rare to have thickening of the wall or peri or fluid يعني around the gallbladder. Now, laparoscopic cholecystectomy is the best method to manage the symptomatic gallbladder stone. If you remember, we said that cholecystectomy in asymptomatic gallbladder stone is not indicated unless we have porcelain gallbladder or children with gallbladder stone. This is a brief talk about gallbladder stone, symptomatic and asymptomatic gallbladder stone. In the next video, I'm going to talk about the complications of gallbladder stone. Thank you very much for watching.